Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for making time on Tuesday afternoon to join us for our COVID update. This should be a pretty quick one. Overall, our situation, I think, is as good as it can be. We are holding steady. We're continuing to watch carefully and really trying to remain proactive in all the aspects of our public health response, which I think we're doing. And I want to thank all of you for doing your part in that regard. And we are seeing that in the data and in the numbers. So by the numbers right now, we are at 2,420 total cumulative cases. That's out of over 112,000 tests now completed. Thankfully, the recovered number continues to go up, well over 2,000, 2,138 now. And also, thankfully, the fatality number has continued to hold now for several weeks at 95. So we are very glad to share that continued good news on that one. In terms of hospitalizations, we're still holding there as well. We're at 8 hospitalized right now, including 1 in an ICU bed on ventilator. This number is definitely been up the last 2 to 3 weeks, but is still nowhere near the numbers we were at, of course, at the worst of this in April, May, and early June. So as long as we can keep the total infection numbers and new infection rate down, which we have, we think that this will hold relatively steady. In terms of active cases in the county, this is also slightly elevated from the best we've been, but not by much. We're at 187 active cases, and you can see clearly on the graph that we've been right around that level really since early July. But at the best, we were approaching 100 active cases, and of course, we want to get down to 0, and we're continuing to work and push to do that every day. The most important metric that we continue to look at and continue to feel encouraged by is the number of new positive cases compared to the number that we're testing each day. So I always share that and use that as our main guide of how we're doing. In the last 96 hours, we have tested 3,531, 3,531 tested, and had only 23 new positives. So that is very good. That's at a 0.65% new infection rate over a 96-hour period. In the last 24 hours, we're even better than that. We had only 3 new positives out of well over 700 tested, so that's under 0.3%. So we feel good about those numbers, but of course, don't want to use that as an excuse to let our guard down. This is a direct result of following all the different precautions that we talk about and that we'll talk about here shortly. But again, it shows that if we all put our mind to it collectively as a group and as individuals that make up that group, we can affect our path here and our destiny, if you will. So I ask everyone to continue to help with that. We talked a little bit about current hospital capacity, forward-looking hospital capacity. We have more than adequate numbers there, 51 hospital beds, 8 ICU, and 37 ventilators. And you can see the current numbers of COVID-19 patients hospitalized right now at 8. A little bit more about what we're doing to remain proactive at least at the county level and county government level and our partners. Number one, as more and more schools are starting to come back, we continue to work our school rapid response plan. Many of you have probably followed in your different districts. There have been a small number of cases in some of our districts, but so far our school rapid response plan is working. We quickly are detecting usually only 1, maybe 2 cases. We know about it right away. We're surging resources to contain that and doing rapid contact tracing. We're keeping the public informed, including, if you haven't seen it, a school-specific dashboard that tells across the state, parents and students and teachers and anyone else who's interested what's happening in each school in terms of COVID. So that's a really important way to keep everyone informed and aware. So far, we feel good about that school rapid response plan. I think is a credit to the whole team that's been working this, all of our school leaders, and especially the health staff within each school that I know are being asked to do a lot, and we appreciate that, and we support you and our health department working with you. Secondly, I talked about this last week in terms of staying proactive. We did submit our request for rapid testing resources here in the county, and have had ongoing discussion with state DOH about that. As I said last week, we think it'll take a few weeks to get this capacity up, as those resources are initially focused on the bigger hotspots across the state. But we have done the work on our end, have our plan ready, and are confident that we are going to start receiving those tests and necessary equipment so that in the worst case where we do have a surge, we have that rapid testing capacity that we can direct at wherever that cluster might emerge, whether school, senior facility, or really just wherever that emerges. And finally, in terms of staying proactive, we have also begun at the county level, in coordination with New York State, preliminary planning for vaccine distribution. Obviously, we're still at best several months off from having approved vaccines, from what we're hearing, but we want to be ready with our own plans to think through how those will be distributed and administered, ensure that there's transparency, equity, and ultimately effectiveness in how we roll out any vaccines. So I've directed our team to start that planning with our health commissioner and the staff in my office. And of course, we're working closely with New York State, who earlier this week, actually over the weekend, rolled out some of their initial plans and sort of the framework for how they're thinking about vaccine distribution. So on all these different dimensions, I just want everyone to know that we are never sitting back here. We're always thinking about what's next, trying to look around the corner and make sure that we're doing our planning so that we can continue to keep everyone healthy and safe as things change, as new resources are available. We're always pushing to have access to those and to be rolling those out. So I want to thank my team, our health commissioner, Dr. Smith, Deputy Executive Mark Ryder, who's been leading this, and a lot of other folks in the team for continuing to keep us at the forward edge of this. And I think, again, we're seeing that in all of our numbers. So that's what we're doing collectively as a government and so on. Individually, though, is really where we can move the needle and ensure that we keep the numbers where we are. If every single person in our county and in the wider community continues to take this seriously and continues to do the three big pieces that we all are very familiar with, I hope now: wearing a mask, maintaining social distance, and washing hands. If we continue to do those things, we know that it works, and that we'll be able to keep these numbers in check. We know that the risk does go up as weather gets colder and more people go inside, and so it's even more important now that we continue to take this seriously and really follow the relatively easy steps that everybody, really all the public health experts, have outlined as critical in making the difference. So that's really the gist of our update today. As we wrap up and thank all those that have gotten us to this point, I want to give a special shout out, or really make people aware. Thursday night, so 2 days from today, the Ulster County Chamber of Commerce hosts their annual Business Recognition Awards, which most years is a great event with hundreds of people and lots of fun and good food and good company. Obviously, it's not going to happen that same way this year, but they are hosting their awards on Thursday night to recognize business leaders and entrepreneurs, young business people, and a few other categories. This year, to think about what our small business owners have been through and are going through, and we know there are over 7,000 of them in the county. it's a small moment in the midst of a lot of challenges to recognize and appreciate all of our business owners that really power our economy and create jobs and create much of the fabric of our community here. I just want to thank each of you for hanging in there through exceptionally difficult situations and challenges and circumstances. And I hope that the ceremony on Thursday night, if you can tune in online, that it'll be on, I think, Facebook and a few other formats. But it'll be a chance to just celebrate what everybody's accomplished, even in the midst of one of the toughest years in memory. And in particular, every year the Chamber of Commerce, the Ulster County Chamber of Commerce, gives what's called the Heart of Ulster County Award. And usually this goes to an individual who really exemplifies the heart and the energy that make our county so special. And this year, for the first time ever, the Ulster County Chamber of Commerce, under Ward Todd's direction, is actually awarding this to the people of Ulster County, and especially to our hometown heroes. And I think that's just such a powerful gesture as another way to honor so many of our frontline workers and our really folks that have been heroic in stepping up, many cases not knowing they were signing up to do this, but being willing to take on risk for the greater good of our community. So I want to thank Ward and the Chamber for choosing to honor all the people of the county, and especially our frontline workers. I think that's really cool and says a lot about our values as a community, that's who we're choosing to recognize this year. I feel the same way, and I hope that everyone, if you get a chance to tune in and catch some of that on Thursday night, it'll be a great event, and I'm sure it'll be stored online and able to watch if you can't make it live. So on that note, from me as well, thank you to all of our frontline workers. And really to all of you for tuning in and continuing to hang in there through this tough time. We're not through it yet, and we'll continue to have some bumps here, but I think we've shown our ability to be smart and tough and resilient, and I know we're going to continue to do that. So on that note, I will let everybody get on with their day. We will see you again for our regular update on Thursday at 2 p.m. I want to thank Radio Kingston, as well as Diane and Manuel, for helping us bring this message to you, and also remind everyone as we go that if you or anyone you know has any needs, you can always contact our Recovery Service Center. The number and the contact is right up on the screen there, 845-443-8888. And until then, stay safe and healthy, and be resilient, and we will see you in 48 hours.